moment to tell us all about cancer, all about how we can, prevent it, number one, detect it, and also how to treat it. Everything to do with cancer. So thank you again for joining us on the Health Talk. Let's talk about cancer. We have two leading oncologists with us. We have Dr. Anshuman Kumar, a well-known and recognized oncosurgeon in India. He has over 15 years of clinical experience in surgical oncology. He frequently conducts hands-on programs and delivers lectures globally on cancer management. He's based in Delhi, in Gurgaon, and he's really an expert at what he does. Then we also have Dr. Rajesh Kalwani, who's based here in Jakarta, and he's been a supporter of Indo-Indians and doing a lot of health talks with us. He's an internist, hematologist, and oncologist. He's been practicing for over 20 years in Jakarta in a private hospital and clinic, and he's active in various medical associations and has spoken at various international medical conferences. Welcome, Dr. Rajesh and Dr. Anshuman. Thank you for being here with us.
Good afternoon.
So first of all, I'd like to start with, now anybody you talk to, anybody you, mention, any families, there's always somebody who's suffering from cancer. Why has this suddenly become like, so common? Why has cancer become so common? Why do you think has led to this increase in, this problem? Dr. Rajesh, would you like to start?
Yes, thank you. I think the number of cases is definitely increasing. The incidence and the prevalence both seem to be going higher as we see from year to year. But probably there are two reasons why we see more cancer cases. One is the detection is easier. So early detection is easier. People are more aware. So diagnosis and awareness is easy. I mean, because the people are more aware, the diagnosis is easier. And secondly, also because of the environmental changes and the lifestyle changes that we're all going through.
Right. So it is because of better detection and change in environment conditions. Dr. Anshuman, what would you like to add to this?
Definitely, I do agree. But if you make it a proportionate measurement of how much is the increased incidence because of detection rate and how much is the increased incidence because of other changes, means increased incidence crude rate, you'll come to know that detection obviously has increased because of better awareness and better technology availability. But still, the advanced stage cancer cases are getting more and more detected. That doesn't get reciprocation from the increased detection rate because of increased technology. Because technology always detects at earlier stage. Because,
Right.
For example, mammogram can detect breast cancer at very early stage. Even clinician can't palpate it. Means 5 millimeter tumor, 1 centimeter tumor can be detected mammogram. But still, even in India, we have been detecting the stage 3 and stage 4 cases more and more than stage 1 and stage 2. Therefore, incidence has increased crude as well as because of increased detection, because of awareness and increased technology. And increasing incidence are because of many things. All factors are surrounded you, from your kitchen to your environment, to your lifestyle, to your mental health, to your physical health, your social health, everywhere, all around, you have been surrounded by carcinogens. That is the major factor.
Right. So we are all surrounded by carcinogens. And sooner or later, everybody, depending on our immunity or how our body reacts to it, it depends whether we, fall prey to this disease or we overcome it. So how many types of cancers are there?
Dr. Rajesh would like to answer it?
Maybe both of you can add to this.
A lot, as many as according to your body parts. Cancer can affect any part of your body, from the skin to the organs. So it can be the brain, can be breast, lung, colon. There's many organs that we can think of, and then per organ or per type of cancer, as you know, there are different subtypes depending on the pathology and the type of cancer. So it's just a vast number of um, cancers, and plus the subgroups and the subtypes. If we go by organ wise, then it's any organ can be affected, from your hair, from your skin to any internal organ to the blood. Any part of the body can be affected.
So it doesn't look at age groups, or anybody can get affected by cancer?
There are certain types of cancer which affect a particular age group, but basically anybody can be affected by cancer. We have cancer cases like from neonatal age, from pediatric age, up to geriatric. So anybody can get affected.
Right, right. So, Dr. Rajesh, in your experience, what has been the most common cancer that you have come across?
I think in each country it is different. Maybe Dr. Anshuman can add on according to the incidence and the prevalence in India. But in Indonesia, what we see is the leading cause of what we see more cases of is breast cancer, followed by lung, cervical, cervix cancer, and carcinoma, nasopharyngeal carcinoma.
In Indonesia or in India?
In Indonesia, the most common is breast, followed by lung,
Right.
cervix, and colorectal and nasopharyngeal. Those are
I
the
see.
5 top
5 top cancers.
cancers. I think in some other countries, lung cancer is more prevalent. Maybe Dr. Anshuman can throw some light.
Yeah, Dr. Anshuman, in your experience, what are the most common types of cancers that you treat?
Yeah. See, India is a big country, and as we will discuss later on, the carcinogens, means the causes of cancer, are around you. Therefore, the incidence or type of cancer varies from one area to another area. If you look at the northern part of India, head and neck cancer, means the cancer of the mouth, cancer of the throat area, and cancer of the lung are more common. If you go
Right.
to south part of the India, cancer of the abdomen, pancreas, stomach, colorectal are more common. That is,
Right.
but if you consider the country entire India, still the cancer cervix is most common cancer of women in India, barring the metro city. In metro city, breast cancer is the most common.
I
But
see.
overall, if across across all female, cervix cancer is the most common. Lung cancer is on the top in the men, and second is the head and neck cancer. Means both lung and head and neck cancer are tobacco-related cancer. Means tobacco is pointing towards the.
I think we have there's some Dr. Anshuman, we lost you briefly, so maybe you could repeat. We can't hear you. I think we've lost connection. So while we get him back, Dr. Rajesh, is cancer contagious?
Some types, mostly not. I mean, it doesn't spread from person to person, but some cancers are due to an infection. So
Oh,
cancer and hepatitis B infections can lead to liver cancer. So basically, some viral infections can lead to cancer. Among the top three are hepatitis B, which leads to liver cancer. Then there is Epstein-Barr virus, which leads to uh, cancer of the nasopharyngeal, and HPV infection, which leads to cervix cancer.
right.
Which is part of one cause of cervical cancer.
So currently there is this, there's a lot of focus on providing HPV vaccine to young women. What is your view on that?
I think it's good, and at least one way of prevention of cancer, as you were saying, like why the number of cancer cases is going up, and so one definite approach would be through prevention. We are lucky that we have vaccines for hepatitis B, and now we have vaccination for HPV. But the vaccination does not mean that the person will be totally immune to cancer, because it just protects infection from a few subsets of the viral infection.
Oh, so it's not like a total protection.
No, no. And now
True.
it decides for girls in the Western countries and even here in Indonesia, we are started even vaccinating the HPV vaccines for boys,
Oh,
considering
for
that
boys.
the virus does spread through contact, sexual contact, and so boys are also being vaccinated for the HPV.
I see. Dr. Anshuman, what is your view on this? Is
Yeah,
there a,
totally agree with Dr. Rajesh. Yes, it is because of human papillomavirus. Mostly strain 16 and 18 are the more common causative agent. And it's the same virus. You can see the skin tag. We normally call it wart. The strain is different only. 6 and 8 causing skin wart, that is papilloma, and 16 and 18 strain human papillomavirus causing cervical cancer. But
right?
still, the vaccine protection rate is not 100%, as Dr. Rajesh has already enumerated. Then what is the solution to make it more and more effective? We have to educate our young women, young girl, and young boys. Unprotected sexual intercourse can increase the incidence of cervical cancer, number one. Number two, uh, proper personal hygiene. That should be education should be started at the school level when the young girl is entering to the age of 10 to 12 years. Personal protection. The moment she starts menstruation, personal protection and personal how to clean the private part, that should be started. Number one. Number two, uh, education of the male boy, the multi-parous, multi-gamous partnership increases the chance of cervical cancer in the lady, in the spouse. Therefore, cleanliness, hygiene, education, and vaccine, if we combine all together, we can increase the chance of protection or prevention of the cervical cancer.
Right, right. So it is not just the vaccine. It has to go with hygiene, with awareness, and being
True.
very aware and mindful of all the actions that they take to prevent this kind of cancer. I heard both of you talk about breast cancer. What can be done to prevent breast cancer?
It's a very difficult question.
Because it seems to be the, you
Prevention
both
is,
have seen that to be the most common cancer.
we don't know, because most theories which stress on the cause or on the etiology of cancer itself is not very proven. I mean, we just know that some of the etiologies or some of the causes of cancer, but it's not like direct proven causes. So talking about prevention is a bit difficult. Maybe what we should stress on is like early diagnosis. As um, early diagnosis could lead to better chances of a cure.
Right,
Besides that, like, prevention for all types of cancer would be more or less the same. One, where like maybe stress on nutrition. There's certain foods which should be avoided, and then physical activity, maintaining a good lifestyle, exercise, uh, trying to maintain weight, and because obesity and overweight is one of the causes also of malignancy.
right, right. So, is it true that breast cancer is hereditary? If it can it run in the family?
Yes, it's not hereditary, but it's like more genetic, we say. So it's if there's somebody in the family who has had a history of breast cancer, then the same family members are at a risk of cancer. it's not always the same type of cancer. I mean, the genetic factor is there.
So it may not be hereditary. So if they have a history of breast
It's
cancer,
a
so
genetic predisposition, we call it. It's not like not directly hereditary, but the risk is higher if there is a family member who has the cancer.
yeah, what is your view on this aggressive mastectomy, like what Angelina Jolie did?
Maybe Dr. Kumar could answer that. Yes.
Yes, Dr. Anshuman, what is
Yeah.
your view on?
That's Yeah, that's actually, see, we have to understand the familial cancer and genetic cancer. There are two different entities. Some cancer has natural tendency to run in the family. That is different entity. Genetic cancer is related to certain genetic mutation, genetic changes in the individual, or it may run hereditary from mother to the children to the next generation to the next generation.
Right.
Angelina Jolie has different kind of genetic alteration in the family. We call it technically BRCA, BRCA, BRCA1 and BRCA2. There are two types of genetic mutation. Her grandmother, her mother had breast cancer, and when BRCA came into picture, she was tested positive for BRCA. There was high incidence of BRCA positivity, high incidence of breast cancer. Technically, gland of the breast has been removed and reconstruction done in the same sitting. That was the scenario. But to tell you, the BRCA genetic mutation doesn't only increase the risk of breast cancer. It increases the risk of ovarian cancer as well as peritoneal carcinomatosis. Therefore, BRCA genetic mutation patient or person might have to undergo certain surveillance procedure, screening procedure in the future to screen for the ovary, screen for the peritoneal carcinomatosis. That is one. Well, I lost connection while we were discussing about the cancer, the organ affected. That time I lost connection. One thing I'd like to add upon. What is cancer? We have to understand so that we can naturally understand which organ we can get affected from the cancer.
Right.
Cancer is nothing else coming from outside. It's our own body cells. This aimless and purposeless growth of our own body cells is cancer. This is very simple. Therefore, any organ of the body can get affected if you get any carcinogen exposed from the atmosphere, from your inside, from gene, right? Just imagine the least chance of getting affected by cancer is the heart. Okay. Imagine. Because every time 24/7 heart is working, heart is functioning. And the only tumor we commonly encounter is atrial myxoma. It's a non-cancerous tumor, simple tumor, benign tumor, very rare tumor. But heart doesn't get cancer. Modern medicine or allopathic medicine has not reached up to that level. Whether it's more and more activity decreases the chance of cancer. Because other organ, breast, lady getting cancer when breastfeeding stops usually, or a young lady getting breast cancer if menstruation is early, or menopause is delayed, or breast is not lactating, or there are certain theory if mother is not feeding the baby, there are high incidence of breast cancer. Again, inactive organ, more chance of cancer. Means inactive human body, now medical science has accepted that inactivity increases the risk of cancer.
Okay.
So, apply to your organ. Therefore, be active if you want cancer-free life. Be active in your life, but not stressed. Some people think that active means mentally stressed. No, mentally relaxed, physically active.
It's a very tough call. It's a very tough call to be mentally at peace and physically very active. I think it is the ideal of what we all want to be. And
but Poonamji, I'd like to add upon, because people may think that I'm talking some theoretical issues. This platform right now, what we have been discussing, obviously discussing academic points. If they want, we can guide them. If people, those who are watching are streaming, they want, it's really possible to be mentally relaxed and physically active, if they want. But I can guide how it's possible. Yes, Dr. Rajesh.
Yeah.
Your take
I
on that?
think it's like really proven, and it's just not an opinion. In fact, several papers and several research have shown that even for colon cancer, it's been proven that uh, physical
So
activity, physical activity or exercise of just 30 minutes could reduce the chances of colon cancer by 50%. So, totally agree with Dr. Anshuman.
every organ,
Yeah.
if you are constipated, colon cancer is more. If you are sitting, obesity increases the many cancers. So the uterus cancer, endometrium cancer, there are many cancers.
Right.
Therefore, be active, yes, but mentally relaxed.
I think that's a very good message. It's a very good wake up call that the more active you are, the more disease free, cancer free life you can hope to have. I think that's a very good message. Um, why is it that sometimes people, when they get sick and then they have radiation treatment, some people don't want to get radiation treatment? What is your view on that?
Yeah, I'd like to add upon. See, I was trained from Edinburgh MRCS as well as my MCS degree from West, Ahmedabad. Ahmedabad had a different opinion among public or public perception that time. And when I joined Delhi, the perception was entirely different.
Hmm.
In Western part, because cancer treatment that time was very advanced in Western part of India, means Mumbai and Ahmedabad. People were so aware that they love to get surgery done because they know surgery was the better treatment of cancer. When I came to Delhi that time, people was scary about this.
I think we are having some technical issues again from Dr. Anshuman's end. Dr. Rajesh, would you like to tell us about your opinion on this?
I think it depends on the type of cancer that a person is suffering from, and it should be seen like what is necessary and
People are getting
what
more and more scared about radio. Hello.
We lost you in the middle, Dr.
Okay.
Anshuman. Yeah.
Uh, yes. Now people are getting, as you rightly pointed out, getting about scary about radiotherapy, radiation. The reason being, radiation has some side effects. Obviously, everything has side effects: surgery, chemotherapy. So the radiation. After getting 10 to 15 fraction of radiotherapy, means 10 to 15 courses of radiotherapy, usually 30, 35 radiotherapy are being given. People get some kind of rashes, sore, and at that time, if there is any negligence on the part of the patient, relative, or doctor, means care of the throat, care of the mouth area, or care of the any treating area, and care of the nutritional aspect. If that is not there, then radiation means a complication. The chance increases, and even sometimes it becomes fatal.
Hmm.
Therefore, people are getting more and more scary. Therefore, again, awareness is the only answer. Doctor and patient, good relationship building. Doctors should listen carefully to the patient problem. And if patient is getting any electrolyte disturbance and nutritional disturbance, that should be corrected at the earliest possible. Dr. Rajesh can add on.
yeah, I think it depends, as I was saying, depends on the type of cancer that the patient is suffering from, and we should see what's the best probability of a cure for the patient. So the patient has to work together with the doctor and understand that the intention, that whatever the doctor is offering is for the best intention. And it's not that all the types of cancer can be treated with radiation or with surgery or so we have to work in a team, and then usually we decide what's best and what would be giving the maximum cure for the patient. But and radiation in itself, as Dr. Anshuman has said, is not easy. It has to be like properly monitored, and usually we do a
So,
periodic checkup of the blood as well to see whether there's any effect on the hemoglobin and there are some cases in which we do radiation and chemo at the same time,
Right.
called a combined chemo radiation.
Yeah.
And even in those cases, we have to see whether the patient for each visit, whether he's fit for the radiation or whether he's fit for the chemotherapy. It's a bit complex, but we all have to work together as a team and see what's right for the patient.
Correct, correct. But I think I have jumped ahead of myself and asked you a question about radiation, whereas what I should have done, and now I'm going to do, is to ask you more about detection, because we spoke about prevention, being active, and being, being mindful and aware of all our actions. But what about detection? What are the signs, the common signs and symptoms of cancer?
Depends on which body part is affected. As we said, there are many different types of cancer affecting the various different organs. So the signs and symptoms are usually very varied. It can be from the most common, we're talking about solid tumors. Like cancer, we divide into solid tumors and non-solid tumors. Solid tumors are the one in which there is a growth, there's a lump. So early detection of a lump would be like through physical examination, and also now we have various screening procedures which we do according to the age. For example, in women we advise mammogram periodically, and then uh, colonoscopy for those above 50 or earlier if there is a family history or if there is a risk of cancer in the family. So
Right.
usually we go by screening according to the age and according to the family history, and if there are symptoms. Symptoms would depend, it's very varied. From, if you see blood cancer cases, usually there's fatigue, weight loss, unexplained fever, all that would be signs to screen for cancer. And
Okay.
usually a routine blood test, or if you're going for a routine checkup or yearly checkup, then there might be some subtle changes which the doctors should see and advise you further.
Right. So this thing, Dr. Anshuman, this general perception that any sudden weight loss or weight gain or this sense of fatigue are the first signs that should give you a heads up that there's something wrong with you.
Yeah. Very rightly pointed out, Poonamji. Even in medical books, while medical MBBS graduate, we were taught that weight loss and fatigue are the sign of cancer. But Dr. Rajesh can understand and totally agree that being an oncologist, now we can say, don't teach weight loss and fatigue are the sign of cancer, because bearing few cancer like lymphoma and leukemia, these are the sign of advanced cancer, not the early cancer, which is
Oh,
not our idea to detect. Our idea to detect cancer either at the pre-cancer level or at the earliest possible level, not in stage 4. And just to summarize the whole body part, what are the different points you have to see regarding symptoms of cancer? Any sore or ulcer which is not healing over a period of 3 weeks. For example, if you're a tobacco smoker or chewer, if you have any sore in the oral cavity mouth or any sore anywhere in the body, like skin or anywhere, if it's just not healing, you have taken all the treatment, antibiotic, steroids, or painkiller, or whatsoever you want to take, but it's not healing. Go and consult any of the oncologists. You might be having cancer. Any lump which is of recent onset, recent past, increasing in size, usually not painful. Cancer is not painful to start with. People think that if it is painless, how it can be cancer? Cancer is painless to start with, later on it becomes painful. Therefore, any lump, don't ignore it. Any abnormal bleeding, for example, ladies, females, if they have abnormal bleeding other than a menstrual bleeding, in between, during intercourse, or any longer period of time, consult doctor. Any bleeding in the urine, any bleeding with the stool, any bleeding from the nose, any bleeding from the sputum, but like while coughing, must consult doctor. Don't take it lightly. In majority of the time, more than 70-80% of the time, you will be suffering from any of the non-cancer diseases. But 20% we can detect cancer in the very early stage, because that is the chance of missing the cancer. Again, more common. I also observed while I was in Jakarta, dyspepsia, acidity kind of problem, which is very common in India, Indian complaint, and Indians are getting over-the-counter medicine, which is maybe common in majority part of the world. Dyspepsia means acidity, fullness, or distension, or indigestion. These are the mixed symptom of many cancer, like cancer of the gallbladder, cancer of the stomach, or even early stage ovarian cancer presents with the same symptom. Therefore, any abnormal finding in your day-to-day life, don't ignore it. That is the take-home message. Don't ignore it. Consult your doctor. Discuss with your friend. Those who are medically aware, discuss with them, or get on more and more awareness. But at the same time, what? Don't consult Dr. Google. That is deadly. That is deadly. The moment you type your symptom, first thing will come cancer. Don't consult Dr. Google. It's very fatal and deadly across the globe.
Right.
There are many qualified doctors. You can consult them.
Right.
Yeah.
Thank you. Yes, Dr. Rajesh, what do you think about Dr.
I
Google?
couldn't agree more. Yeah, I think most people panic with this, just typing the symptoms on Google and then going by severity. I think that usually it comes cancer and all, sometimes might lead to a panic situation. But I mean, yeah, I think in your especially in Jakarta or in Indonesia, you should have one physician who you can easily consult and who you periodically consult with. Somebody who knows your history, because if you go to a new doctor, if you don't have a family doctor, then it's difficult for the physician to know what you were last year and what changes you're going through.
Yes, you're very right. I think Dr. Google is like self-medication. You might go wrong.
Yeah. One thing you everybody must listen about Dr. Google. You can find each and every answer except one answer. If you type how to calm down your wife, Google is still searching. That's the only answer Google can't give.
Yeah.
You can type and search it.
No, it's Mr. Google or Miss Google.
I call it Dr. Google.
So, we've been talking about cancer prevention and detection so far. We have some people online with us on Zoom. If anybody, we take 5 minutes, and if they have any questions for both our esteemed doctors, please go ahead, raise a hand on Zoom, raise a hand, or you can unmute yourself and ask a question. We have 5 minutes Q&A in the middle, just after how to prevent and detect cancer. If there are any questions, we have 5 minutes. Anybody would like to ask a question?
Or even they can text it.
Or they can just
Rajni
type the
Hansam.
question as well, and then we can answer the question.
Rajni ji wants to ask something. Rajni Hansam.
Hi,
She's raising
Rajni.
her. She has to unmute. Yeah, she has to unmute.
Yes. I think I'll unmute everyone for this at this moment, so everybody can be unmuted. Okay. Yes, Rajni, please unmute yourself and go ahead, ask your question.
No, still she's muted.
No problem. It's I think people are unable to unmute themselves for some reason. Okay, no problem. I think I have a lot of questions, so I will continue asking the questions. So, Dr. Anshuman, when people are come up with a diagnosis that they might have cancer, I think it is a big mental shock. It is like it's like a death sentence sometimes. That I have cancer, and sometimes it could also affect the self-esteem very deeply, and you also feel depressed on how you can manage your cancer and manage your life going forward. So in the course of all this treatment, is there some mental support available? Is that part of the treatment?
Yeah. First, see, discussing cancer on the digital platform appears very easy, but discussing a patient recently diagnosed with cancer one-to-one, as a doctor, I can tell you, as a doctor, Dr. Rajesh can tell you, that's really a challenging job. It's not an easy job. if I can say you, a bomb diffuser, bomb expert, if he wants to diffuse a bomb, it's just diffusing the agony of the patient when a patient gets diagnosis of cancer. That's the moment. We have to diffuse that bomb. Why I'm calling it bomb? Number one, disease. We know how to treat it. Not a big job. But patient doesn't know because they have not read the medical science. For them, it appears as death sentence. Number two, mental agony. They are started calculating everything, their social impact, their business impact, their job impact, their social stigma, you can say, and especially for female, cosmetic, and if suffering from breast cancer, there are a lot of issues are there. Then financial aspect comes, how we can get this treatment done, what will be the cost involved, what will the outcome and everything. And then where to go? Who is the best doctor? What is the best hospital? There are many issues. And doctor, oncologist has to be very patient listener, number one. Rather than vocal, he has to be listener. He has to listen to the problems because problems are not as much as the patient thinks the moment she gets or he gets diagnosed with a cancer. Therefore, it's a panoramic approach of treatment, not only hitting the bullseye, unlike other diseases. If somebody had cardiac problem, any problem for that matter, you can hit that point. But cancer hits many aspects, and you have discussed all those issues. And slowly, an oncologist become part of the family of the patient. That is the scenario. In one end, we are just taking out the concept of family physician, but another aspect, oncologists become the part of the family. That is the issue.
Right. I see where you're going because it's a much bigger problem than just a disease. It's a whole life-changing moment at that moment. What do you think, Dr. Rajesh, in your opinion? Is there some kind of a mental support, emotional support that is provided?
Challenging because we're not just dealing with disease, but we're dealing with the whole person, the family, the social impact, the economic impact that it will have on the patient and the family. So, but here, luckily, we have a few qualified nurses and physiotherapists and patient support groups. Depending on the type of cancer, we have different support groups. Like there's a lymphoma support group, and there's a breast cancer support group.
Right.
Yeah, but it's quite a dilemma, especially we see that if we diagnose the patient, and then there's always the question of how we're going to put it forward to the patient, and sometimes the family is also, like telling us not to tell now, or to tell now, or not to tell the patient.
Yes.
It's a big.
I think that is also a big issue. Sometimes they don't want to tell the patient at all that they have cancer, that they might get.
Quite a stressful situation for the doctor as well, because we have to see from the patient point of view, and if he's an adult and mentally stable, there are a few ethical points that stop us as to tell us that we should inform the patient. So discussing that itself takes a few days. But then there are a few, we're seeing because of the awareness in the public is getting better, we see quite a lot of cases in which the patients are very confident that they're going to get well, especially with our breast cancers and lymphomas. They know they can get well, especially if they've been detected in the early stages. And we have women, and they're quite confident. They come for the chemos and radiation sometimes alone, and sometimes after a few sessions, if they're in the maintenance, they come during their office breaks. They're quite confident. They come alone because the treatment now is like much better than if we put forward just the word chemotherapy. The layman usually thinks, oh, I'm going to be like all in a bad condition. I'm not going to be able to walk, or I'm going to be vomiting. but with the help of medication, I think that's changed quite a bit. Especially we have a good team and all the this we can predict the side effects, the complications that are going to arise, and then we can handle them quite well. And
Yeah.
so
Okay.
bad as some people picture it.
Yeah. So, I have three questions now. So one of the questions is, are most breast lumps cancer? If somebody sees a lump in their breast, is it cancer?
No, no. Majority of the breast lump, especially if pains before menstruation, 4 or 5 days before your menstrual cycle, it is not cancer. Most of the time, fibrocystic disease is a condition, or fibroadenosis, we call it generally, because of hormonal changes. It is not cancer.
Okay.
But how you will differentiate? Every month you're getting pain along with lump. It is not cancer. If lump is of long onset, diffuse means you can't focus it. This is diffuse lump. How will you palpate? Not like this. You have to palpate with the pulp of the finger, pad of the fingers, not like this. Otherwise, all the breast is lumpy. No one will see any breast without lump. Therefore, don't palpate like this, palpate like this. If you palpate like this and you're getting recent onset lump, usually painless, get it checked. Otherwise, painful lump, usually with menstruation, it is not cancer.
Okay. Thank you. There's another question on information on prostate cancer. At what age does one usually get prostate cancer?
It's more common in elderly men.
So what age would that be, Dr. Rajesh?
Usually above 50, but the incidence is higher at an age even higher.
Right. So they should go for a regular checkup.
We have men diagnosed even after 65, 75, 80. As the age increases, if there is a genetic predisposition, it's higher. So in elderly men, usually we advise there's a blood test which is called a PSA. We do that periodically, and of course full physical examination, and then
Right.
usually men there would be a complaint of difficulty in passing urine, and if the, which is also age related, but then a screening for prostate PSA is mandatory, and then also as Dr. Anshuman had said, any abnormal bleed, so any urine that is with a bleed or any abnormal bleed would be a sign for.
Yeah. So I think would you suggest that it would be a good idea to get a screening done, so to rule it out? Is that the way to do approach?
Usually it is part of a medical checkup.
Okay. Okay. Another question is, what are the side effects of long-term use of anti-cancer tablets like tamoxifen, and what about depression and joint pains? Does it lead to that?
Yeah. Usually depending on the type of cancer, depending on the type of breast cancer, we usually prescribe tamoxifen either for 5 years or even more up to 10 years. One of the common side effects is joint pains or arthralgia, as we call it. In some people, there could be some other problem, but mood disturbance and all usually not a side effect. Depression and all, no.
Right.
Usually we have to monitor the liver functions, kidney functions, and yeah, joint pains are quite common.
I see. They are common, is it? Okay. So, Dr. Anshuman, I have a question for you from Geeta. She's asking, how much does diet and lifestyle help in prevention?
Very good question. Thank you, Dr. Geeta. Mrs. Geeta, you pointed out the most valid point, because diet and your lifestyle contribute to 35% of the cancer formation. 35% means majority of the cancer root, you can, if you trace it, it goes to your kitchen and your day-to-day activity while you're either awake or even while sleeping. Therefore, diet very rich in fat, very rich in carbs, especially making you more of moving you, if you are moving to a mode of preservative food, processed food, more chance of cancer formation because of carcinogenesis. Therefore, you have to stick to good amount of vegetable, fresh fruits in your diet, balance of carbohydrate, protein, and fat. Don't ignore any of the three. Someone is going carb-free diet. Again, a harmful thing because there are a lot of social media trending because sugar increases cancer chance. This is false. This is a myth. Without sugar, person can't live. Sugar means, I mean carbohydrate, not especially refined sugar. I don't propagate refined sugar. Stick to the raw sugar. Therefore, balance of carbohydrate, protein, fat, good amount of high fiber vegetables, fruits, all homemade food, that is preferred. That is diet. Lifestyle, social, mental, physical well-being, is cancer prevention dictum, you can say. You can do anything, but if you want to be cancer-free, stick to the classical Indian style living. But you will be surprised why India is getting so many cancer cases. The reason being, even majority of the Indians are not living Indian lifestyle. They are going to the Western lifestyle.
Yeah, thank you, Dr. Anshuman. That is the way. But you mentioned something about sugar. You said, you know, at this moment, people are all over. People talk about sugar being toxic. It is the most toxic thing that you can eat.
See, refined sugar has so many chemicals. To purify that sugar, factory uses many chemicals, and that varies from country to country. Some country using sulfur, some are using bone particles. There are many things in the. If you go by raw sugar, simply speaking, in limited quantity, it's not harmful. Remember that. Raw sugar, I mean, sugar cane extract, classically we call it shakkar, bhura, meetha, gur, that is not harmful unless it is processed chemically. Therefore, don't get somebody is getting panic and obsessed that no sugar at all. That is not the life. Brain requires sugar to live.
You know, when we say that eating an alkaline diet, there is also this fad about alkaline diet kills cancer cells. You know, having and that cancer feeds on sugar. What is your view on that? I think we've lost Dr. Anshuman again, so I'm going to switch over to Dr. Rajesh and ask him about his viewpoint on alkaline diet and sugar.
I've read a few articles and I've heard a few talks on alkaline, but I'm not convinced that an alkaline diet or alkaline water could help to prevent. There's just no substantial data or there's not enough proof. But I think as Dr. Anshuman and as Dr. Geeta would stress, that the most important thing is a well-balanced diet.
Right.
As Dr. Anshuman was saying about carcinogens and carcinogens causing cancer, besides carcinogens, there are 5 important causes of cancer, which is, the first one is high body mass index or obesity.
Right.
So definitely a good diet would help to reduce that. And then the second one is a low fruit and vegetable intake. Anybody with a low fruit or vegetable intake is more predisposed to the risk of cancer. Thirdly is a lack of physical activity, which is another point not related to obesity. So any physical activity, even if you are of normal weight and normal body mass index, physical activity would help to prevent cancer incidence. Besides that, alcohol and tobacco use.
I see.
Alcohol and tobacco use both predispose to cancer. So besides avoiding the carcinogens, these five points should help us lead a healthier lifestyle and thus prevent us from getting being in the risk of getting cancer.
Right. I think those are all very valid points, Dr. Rajesh, all about being active, being eating the right nutrition and managing. So I think by being physically fit, by being active and eating the right diet, you're already avoiding being obese. So you're doing away with, quite a lot of parameters which might lead you to a predisposition towards cancer. So those are very, very valid. What about other factors like microwave? People saying if you use a microwave oven, you might get cancer. What is your view on that?
The microwave itself doesn't cause cancer. It's been proven. Earlier, there were some theories relating to that, but the microwave rays itself does not cause cancer because usually the door for the microwave oven to start, the door has to be properly closed and it doesn't function unless the door is closed. So the radiation from the emission from the microwave is not going to cause cancer. But
Right.
what is more important is the utensil or the container that you use in the microwave. If you're using a plastic container, then
I
you
see.
have to be
Okay.
very
Hmm.
main thing is the plastic, if it's heated to a certain point, and if the plastic is not of a good quality, it might cause scratching of the plastic. We call it scratching or some spoiling of the plastic material, which could affect the food and can cause cancer.
Long and
So if we go by plastic,
long.
if we go by plastic quality, then there is a term which we call BPE. So BPA, the plastic should that you're using in the microwave should be BPA free.
Right. They even say BPA certified plastics for storing water.
Yeah,
They're also talking about
yeah.
uh,
I
yeah,
think if the
BPA.
plastic is exposed to heat, not just microwave, any heat, or if you are putting a hot liquid into a plastic container, then the plastic container has to be BPA free because
Right.
otherwise, even if a small tinge of the plastic, to put it crudely, with just like sort of melts or scratches into the food, then that is a carcinogen in itself.
Right.
So the plastic causes the cancer.
Right. So I think we have Dr. Anshuman back with us. And Dr.
Yeah.
Anshuman, since you are a surgeon, you are an onco surgeon. In your opinion, what kind of is consulting an onco surgeon first, then planning to go for radiation or any other kind of chemotherapy? What is it in your view? What is the best approach for a patient?
Yeah, if you search that again in Google, Dr. Google will refuse to tell you. The reason being, in oncology, we first become oncologists. For example, Dr. Rajesh may be dealing with the chemotherapy part, but first we become oncologists. We know how cancer behave, how cancer reacts, and what are the treatment planning, what are the staging of cancer. Then we go to the specific subject, like someone becomes cancer surgeon, someone becomes medical oncologist, someone goes to radiation oncologist.
Right.
Therefore, if patient is coming to us, we behave as an oncologist, not as a cancer surgeon or medical oncologist. And my philosophy of dealing with cancer is concept of 3M. If someone comes with cancer, the first M is Mazdoor, that is surgeon, obviously, who works every time. Second M is medicine, that is chemotherapy. And third M is machine, that is radiotherapy. How best we can promote, do a permutation combination of all these three to plan best outcome of this patient. And depending on the site of cancer, stage of the disease, and patient general condition, we decide what should be the best idea to operate him first or to give chemotherapy, reduce the size, then operate, or two, not to operate, just give chemotherapy or just give radiotherapy and wait and watch, or do nothing even. Don't operate, don't do give chemotherapy, don't do surgery, don't give radiotherapy, just wait and watch, because cancer is slow growing. For example, SLL, Dr. Rajesh must agree, small lymphocytic leukemia. Keep on observing till the time platelet stops decreasing. That is a kind of blood cancer. Simple language, it's a kind of blood cancer. But keep on observing. Patient remains disease-free, means without any problem for 10 years, 12 years. After that, patient may require treatment. That is the whole idea. Therefore, don't go to Dr. Google to search whom to contact. Contact an oncologist. That's the final word.
Yes, thank you so much. Thank you, Dr. Anshuman. Thank you, Dr. Rajesh. It has been so informative speaking to both of you. We are almost 50 minutes in our conversation. I'd like to open it up again to any questions from our participants or any of our viewers on Facebook. If they have any questions, please just type in your questions and we can ask them. Because we have them, it's a valuable resource, and this is the time to ask questions if you have any. And I really like what the doctor shared, that initially.
By the time viewers are giving their questions,
Yeah.
I started missing Jakarta and your warmth, Dr. Rajesh warmth, and so many herbs and true green vegetables and so fresh fruits you have. Actually, I started missing after 50 minutes of conversation and feeling all nostalgia from Jakarta.
Hopefully you can travel soon.
Yeah, thank you. Just thanks to Corona, we are bound to our own country. Everybody is limited.
Yes, everybody is bound to their own countries. So, I don't see any further questions at this moment, and I'd just like to summarize what I have understood so far. Please add to it. And please, just add to it as I summarize. So what I heard today was, number one, your lifestyle can make a huge difference to your predisposition to getting cancer or not. So the lifestyle needs to be active with a very balanced and traditional diet. So it doesn't have to have refined sugar. It has to have lots of fruits, vegetables, and a very judicious and balanced carbs, fats, and all those as you make it at home. Thirdly, the more active you are, the better you are. And as you said, that the heart doesn't get cancer because it's active all the time. So lifestyle is number one. Number two, if any time you have a sore or a wound, something that doesn't heal, or you have bleeding from anywhere, which is uncommon, unnatural, something that you have not expected, or if you are having a sudden weight gain, weight loss, or you have lumps anywhere, go and meet your oncologist. Don't try to figure out through searching online, because they may not give you the right answer for you. And as far as the treatment is concerned, again, don't try to find your treatment by yourself. Go to your oncologist. The oncologist will look at your symptoms, will look at your diagnosis, will look at all your tests, and then define the best treatment plan for you. So would you like to add to that, Dr. Anshuman and Dr. Rajesh?
No, I
Yeah,
think something like
Dr. Rajesh will first add. After that, I will add on. Yeah.
Yes,
no,
Dr. Rajesh.
you summarized it quite well. Thank you for having us on this platform. If any of the viewers have any questions, maybe they can just message and we'll try to answer them. Thank you.
Thank you. Yes, Dr. Anshuman.
Yeah, perfectly. You have summarized it well till the time what we have spoken. Means only 5 to 15% cancer are genetics, genetic related, gene related cancer. Therefore, means 85% are somewhere around you. At least you can figure out 50 to 60% of those 85%. Therefore, start figuring from early morning till the bedtime. Early morning, you're going to brush your teeth. Minimal of plastic in your life. Minimal or no plastic to your life, number one. Number two, go to nature as far as possible. Go to the natural product. Don't get dragged by organic or herbal kind of thing. You know the nature, you know the trees, you know the fruits, you know the river, you know the soil. Go to the best soil crop directly and take out vegetable. If possible in your country, you can do it. Go to the uh, maximum mental peace, because a lot of mental stress, lot of oxidative radicals in your body, lot of damage to DNA, ultimately leading to cancer. Therefore, mental peace. और जो हिंदी समझते हैं उनके लिए संस्कृत में एक श्लोक बताता हूं, अर्था भवन्ति गच्छन्ति लभ्यते च पुनः 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 कदापि न आयति गतम तो न यौवनम। इसका मतलब, अर्थ का मतलब होता है धन। धन आता है, चला जाएगा, फिर आप उसको प्राप्त कर सकते हैं, लेकिन एक बार जीवन जो मिला है जाने पे दोबारा नहीं मिलेगा। दूसरे जन्म की जो धारणा आप बना के बैठे हैं वो कभी नहीं मिलेगा। इसलिए काम करो, लेकिन इतना मत करो कि अपने जीवन को गंवा दो। तो उसको करना है एट मेंटल पीस। टेक प्रॉपर स्लीप, प्रॉपर हाइजीन, cleanliness of yourself, your family, your surroundings, everywhere. Cleaning. And then when you wake up next morning, be fresh and thank God that you are alive. There are so many people dead today morning and you are alive. Then gratitude. That gives you positive approach towards life. There are few points you must add in your life.
Very true. Gratitude and being at peace and calm. Thank you. Thank you, Dr. Anshuman. Thank you for that very enlightening and informative talk. Thank you, Dr. Rajesh, for supporting us all the time. Thank you. Namaste.